Okay, great. Thanks. Bye. So I've got a few minutes now to just run into the library and do this search. Here's a little background about asthma, a chronic lung disease that affects 14 to 15 million Americans each year, 4.8 million of whom are children. Asthma costs Americans approximately 100 million days of lost work each year, nearly 470,000 hospital admissions each year, and sadly 5,000 deaths. Asthma is a chronic lung disease that is characterized by two things. First is inflammation of the airways, and second is bronchospasm. You can think of the first component of asthma, the chronic inflammation, as swelling and irritation that is inside the airway and leads to difficulty breathing. This part of asthma is treated with chronic steroid use, inhaled steroids, that over time make the inflammation go down and make it easier for a person with asthma to breathe. The bronchospasm is what happens when the muscles that surround the airways go into spasm, mostly in response to certain environmental triggers. The environmental allergens are things like cigarette smoke, colds like viruses or bacteria, and allergens such as pet dander, tree pollens, dust, and molds is another big one. The second component of asthma, the bronchospasm, is treated with an entirely different medication from the inflammation. This medication is an albuterol inhaler, or what's called a rescue inhaler, and that treats the acute symptoms of asthma and releases that muscle constriction in the airway and makes it easier for the person with asthma to breathe. The symptoms of asthma are generally a period of time, usually longer than 6 months, of a person experiencing coughing, wheezing, and a sensation of difficulty breathing that they often refer to as chest tightness. These symptoms can also occur at night.
Let's take a look at two brief movies made for parents of kids with asthma.
Being healthy and able to breathe easily is something many people just don't think about. But if your child has asthma, you know how precious each and every breath really is. When your child breathes in, fresh oxygen-rich air flows in through his or her nose or mouth, through the throat, down the trachea or windpipe, and deep down into the lungs. The air flows into smaller and smaller tubes called bronchial tubes. These tubes contain thin strips of muscle that help control breathing. Inside, the sticky substance, mucus, traps dust and other particles that may have been breathed in. The bronchial tubes end in tiny sacs called alveoli. Here, the oxygen-rich fresh air is exchanged for the oxygen-poor air that your child breathes out. Asthma attacks are very scary for both children and their parents. For your child, not being able to breathe is a horrible feeling. For you, not being able to help your child during an asthma attack is just about the worst feeling in the world. That's why learning about asthma and how to control it is so important. Early in an asthma attack, your child's airways become inflamed and swollen, like the way your nose does when you're coming down with a cold. The situation gets worse when your child's airways react to a trigger. Some common triggers include dust, pollen, cigarette smoke, and even air pollution. Your child's asthma trigger may be different from other children's triggers. In response to an asthma trigger, your child's airway gets narrow and breathing becomes very difficult because the muscles around the airways tighten like fingers gripping a soft hose. The walls of the airway swell up and excess mucus is produced and clogs the airway. As a result, your child may start to cough, wheeze, and struggle for each breath. Sometimes, he or she may struggle so hard that their collarbones and ribs may show. Doctors call this chest retraction.
There are 4 parts of asthma that it's critical for a patient to understand in order to manage their disease well. The first is actually to understand the disease process itself, those 2 things we were just talking about, the chronic inflammation and the bronchospasm. The next most important thing that it's important for a patient to understand is how to avoid those environmental triggers that lead to their asthma symptoms. Third, it's important for a person to be able to monitor their symptoms. And finally, it's absolutely crucial for a patient to understand how to take their medicines and when to take their medicines.